Hello everybody, welcome to Aesthetics Plus Clinics. This is a channel for everything aesthetic in India. I'm Dr. Surindher. I'm the director of Aesthetics Plus Clinics. Hi everybody, welcome back to our channel. We recently got another query because there is a lot of confusion regarding stem cells and fat grafting for the breast. What exactly are stem cells and what exactly is fat grafting when you come to the breast? So, as because of pregnancy or because of various reasons, people tend to lose weight, tend to lose fat from certain areas. Post pregnancy and childbirth, breastfeeding, the most common cause of loss of fat is the breastfeeding itself, because as the glands enlarge, the fat gets replaced, which doesn't come back, and there is a resultant sag and there is a loss of volume. So, to fill that up, we have to do a volume replacement, which can be done either with fat or it can be done with an implant. Now, when it comes to fat, there is a lot of media hype and which goes around with so-called stem cells and fat and stromal vascular fraction. There are so many words that are being thrown around, and as a layperson or as a patient, you're really not sure as what are the options and what exactly you need to do. So, I'm just going to try and clear up a few things here. So, whenever we harvest fat, when we remove fat from the body, in that suction, if we have a certain amount of fat, along with the fat there are certain other things which also come in. So there is something called a stromal vascular fraction, there are some mesenchymal stem cells, there is some little bit of blood, so there are some cells there. All of that it's a combination of them, and then there will be some dead fat cells, everything. So what happens is, when you're talking about fat grafting, we just take the fat, we decant it. Nowadays we don't wash or do anything because we want those extra things to remain there. Of course, we remove the dead cells and the fat which is there, and of course the excess fluid, and we just put in the regular fat inside, and that is replaced. So that just gives you a volume replacement. There are a few things that you need to remember when you're doing fat grafting for the breast. One, because fat is soft, it will give you a more natural look and it will give you more fullness, but it does not give you a projection as much as an implant would, because an implant is a solid silicone gel structure, so it pushes the breast out further, so it gives you a more fuller look and more perky look. Whereas for the fat, it gives you a more fuller look. The breasts look more natural, softer and rounder, but they also tend to drop more and it gives you a more natural look. Second thing is, you cannot fill up too much of fat in one go, because imagine you are putting people into a room, you're pushing people into a room. When you push too many people into the room, the fittest ones will survive, and the rest, and you lock the door, then the rest will survive, will die. So it is again survival of the fittest, and also the ones near this periphery, that is near sources of say air, for example, will survive, and the center ones will die because they are not getting the nutrition. So the same thing happens when you're doing fat. So you can't fill up fat like a whole bunch of it and just push it in, because even if you do, half the fat will not survive, it will die, it will necrose, and sometimes that necrosis can have calcific deposits which will cause more issues. So that is why you have to do a graded expansion, is what we say when you're doing fat. Along with that, second thing is, as whereas when you put an implant, the implant size is fixed, you know how much the size is going to be, and it's going to push that much of the tissues out, and you get a more perky look. Third thing to remember is, when you're doing fat grafting for people who have not had kids or not yet married, when you're going to have kids, when you get pregnant, and when you start breastfeeding, the fat gets replaced. The glands enlarge and the fat gets replaced. So it is just like how it would happen in a normal breast. So once the breastfeeding and everything is over, then the fat doesn't come back, so the sac can still be there. So you might have to repeat the procedure later on once you finish with your family. So these are the two issues that you have to remember when you're talking about whether you do an implant or whether you do a fat graft. But the biggest advantage is that you don't have scars in a fat graft. It's just fat which is injected, whereas in an implant you need about a 2-inch scar which is under the breast in the fold. So what is stem cells? So there are mesenchymal stem cells. There are certain cells within the stroma or the matrix of the from where the fat is being removed, and those cells can be concentrated and they can be enriched. You don't actually call it multiplying, we call it enrichments. They are enriched, and those fat cells, that mesenchymal cells, are able to convert into fat cells. So that is why we include that mesenchymal stem cells when along with the fat, and then we inject it with the aim that it promotes the more formation of fat cells so that you get more volume for the same amount. This is more so better suited for people who don't have enough fat for us to take to transfer for the breast. So what we do is we take out a little fat, we isolate the stem cells either in the clinic, or if we need an enrichment, we send it to the center where they actually take the stem cells, they isolate them and then enrich them and give it back to us, and then we mix it with some of the fat and then we inject it. So that is basically the stem cell injections that we do for the breast, and yes, that increases the survival of the fat as well, and then also gives you better results. But whether fat or implant, what is your choice has to be decided with by you in consultation with your plastic surgeon, who can actually explain the pros and cons. And as I said, you have to see whether you're looking for a one-time procedure which is going to just stay there forever. Of course, implants have their own issues, fat has their own issues, so it's a guided and a informed decision that you have to make as to what suits you. So it's not one thing that suits everybody. So there are options. You have to talk, you have to discuss, you have to identify what works best for you, and we will help you choose and do what is best and right for you.